Greetings, folks. Today we delve into the current predicament of the United Kingdom's National Health Service, or the NHS, a cornerstone of British society that finds itself in a bit of a pickle. Imagine this: an institution projected to swallow almost half of all state spending. That's right, half. You'd expect a shining beacon of healthcare outcomes, wouldn't you? Sadly, the reality is quite different. Despite such colossal investment, our beloved NHS seems to be lagging behind its Western European counterparts when it comes to healthcare outcomes. And now let's talk about the elephant in the room: waiting lists. Picture a bustling city full of life and activity. Now imagine every single person in that city waiting for treatment. Quite a grim sight, isn't it? Well, that's the current state of the NHS, with a staggering 5.8 million patients patiently waiting their turn. And it's not just the numbers that are concerning. The waiting, the uncertainty, the discomfort. It's a harrowing experience that no one should have to endure. But endure they must, as the NHS grapples with the monumental task of tackling these waiting lists. This predicament has led to a rather unexpected consequence. More and more people are turning to private healthcare. But let's be honest, how many of us can actually afford it? For the majority, it remains a far-fetched dream, a luxury that's beyond reach. But here's a question that's been niggling at the back of our minds. Is there another way out of this dilemma? Could there be a solution that doesn't involve emptying our pockets or waiting in seemingly endless queues? Well, that's what we're going to explore next, so hold on to your hats, folks. It's going to be quite a ride. With the NHS's challenges, more people are opting for private healthcare, but only a small minority can afford it. But could there be another way out? Stay tuned as we delve deeper into this conundrum. One potential solution lies in allowing patients to access private healthcare if the NHS fails to provide timely treatment, an approach that has seen success in other countries. Delving deeper into this proposition, the core idea is to create a safety net for patients. If the NHS, for whatever reason, can't provide timely treatment, patients would have the option to turn to private healthcare. Now you might be wondering, has this ever worked before? Well, let's take a look at Denmark and Portugal. In Denmark, this approach has been implemented, and the results have been quite impressive. The waiting times for patients have significantly shortened. Imagine being a patient in dire need of treatment, and instead of waiting for months, you get the necessary care in a matter of days or weeks. That's the power of this system. Moving over to Portugal, they've also adopted a similar system. The impact? A substantial reduction in surgery wait times. That's a big win for patients and a testament to the effectiveness of this approach. Now, some critics argue that this approach would privatize the NHS. But let's take a step back and consider this. Outsourcing and private treatment have already been part of the NHS for years. So is it really privatization, or is it a practical solution to a pressing issue? Whilst critics argue this approach would privatize the NHS, it's worth noting that outsourcing and private treatment have been part of the system for years. The crux of the matter is not about privatization, but about delivering better healthcare outcomes. It's easy to get caught up in labels, to become entrenched in the debate about public versus private. But what we really need to be focusing on is the end goal: better healthcare for everyone. Does it matter if the solution comes wrapped in a public or private package? If it brings about an improvement in healthcare outcomes, shouldn't we be open to it? After all, isn't the health and well-being of our citizens the ultimate goal? This is not to say that we should blindly accept any proposal. It's crucial to scrutinize, to question, to ensure that whatever path we take, it ultimately leads to a healthier society. But let's not limit ourselves by focusing solely on the mode of delivery. Let's look beyond labels, beyond public and private, and focus on the key consideration. Will this approach deliver better healthcare outcomes? In the end, it's not about public versus private, but about the best possible healthcare for the citizens. This is a complex issue, and solutions won't be simple or immediate. But it's clear that change is needed. We all have a stake in the health of our nation, and it's vital that we consider all the options on the table. It's not about privatization versus public healthcare. It's about finding the most effective way to deliver the care we need when we need it. Look to places like Denmark and Portugal, where innovative solutions have helped to reduce waiting times. It's not about copying their systems, but learning from their successes and their challenges. Listen to the debates, read the reports, and most importantly, ask the tough questions. The key is to stay informed, engage in discussions, share your thoughts, and listen to others. Knowledge is power, and in this case, it could be the power to help shape the future of our healthcare. If you found this information valuable and want to stay updated on similar topics, don't forget to subscribe. Until next time, stay informed and stay healthy.